Hi, good evening, fellow brother and sister. I'm Lim Sin Chee. I'm a psychiatrist from Hospital Malacca, and thanks for inviting me and for this talk, today's talk. And it's my pleasure for me to share my one of the area of my expertise is about addictions, because addiction is part of our uh, piece of puzzle and in our psychiatry world. Um, Today I share about how we're using our current contemporary and Buddhist psychology in overcome addictions and also craving for sensual desire. So first of all, today is Independent Days. So uh, uh, we hope that we are independence. We're celebrating our national independent days, and at the same time, we hope that we can independence from the pandemic. And we really hope so, because everyone is at fighting very hard, and then we really start to uh, in the positions of experiencing the suffering. And because of, I think, in the pandemic, in the disaster, and more addiction you will see in future. So, like what Yvonne have tell us, addictions have a few types. So today we are going to teach you talk about what are the types of addictions, and why people get involved in addictions, and how are we going to overcome the addiction problem. So addictions is basically an inability to stop doing or using something to relieve some sense of anxiety or distress, especially they will cause some harmful effect. And we divide them into chemical addictions and also behavioral addictions. So what are the chemical addictions that quite we are well known as, like we are using drugs and also alcohol, and we are using some illicit substances to um, get some happiness and desires. And behavioral addiction is something that a bit new in this world, and we are seeing more and more people in currently have the tendency towards it. And it involves repetitively and persistent behavior that carry on, and if they don't up to a point that they really cannot control, and it doesn't offer any real benefits. So these are the few example of chemical addictions. So we divide chemical addiction into two main groups. So we call it as uh, called, central nervous system the stimulants groups, and also central nervous system depressant group. So for the stimulant group, we have nicotines, cannabis, amphetamine, and methamphetamine, which we have the strict name called it ice or batu, and cocaine in not in Malaysia but in foreign country. Hallucination, there are some like LSD and so on and so forth. And one of the hormones that we are using it is caffeine. So caffeine is part of the chemical addictions that we thought it is not an addiction, but it can be become a use. So in our so-called diagnostic criteria for disorder, it is not including the words using caffeine use disorder. It's caffeine use. Okay, so it is not under disorder because it doesn't cause any significant harm, but excessive using it also can cause some harm to physically. So CNS depressants such as alcohol, opiates, and we use some benzodiazepines such as something calming pill or a sleeping pill. And both can create some significantly effects to our bodies. And how about the behavioral addiction? So behavioral addictions, now we have classified under our DSM criteria is gambling disorder, internet gambling disorder. These are under the, we have already classified under one of the chapters. And so others areas such as compulsive buying. So some people, when they are stressed, they start buying, and the more they buy foolish buying. And some people, when they are stressed, they are doing workout. So even though they work out more than usual, which is usually we recommended 3 to 5 days in a week, they even work out more than that, more than 1 hour, and they just want to experience the pressures, and up to a level that they cannot control. And binge eating, and when people start eating excessively, and when they are especially when they are distressed, so they can binge eating. They eat a lot, and some of them, after they binge eating, they can go into eating disorders, such as after they binge eating, they will vomit it out because bulimia. And the others part, like sexual addictions, they've been finding some prostitutions, and then have sexual misconduct. And this is something that related to us. So we have start to using a lot of social medias. We without reason, we just put up our phone, and then we start to look at the information, whether it is true or not, whether it's fake or not. So TV addiction, we watch dramas series against by against without any reason to let us to feel the pressure. So basically we do everything it is okay, but when it is not okay is when the consequences come to this level, that when we need to spend more time, large amount of time in engaging the behavior. Okay, so when there is a urges engaged in the behavior, and even though it is negatively affect daily life, responsibility, and relationship, I'm seeing a lot of patients. They are like not working. They even that they have a lot of conflicts with their families, and initially the family still accommodate them up to a level that a family member starts to abandon them, and they still continue using it. So using the behavior, or using the substance up to manage the unwanted emotions. This is something that lots of peoples that when they are down into this addictions problem, they actually want to use a method to self-medicate their emotional problem. So they feel distressed, they feel painful, emotional pain, angry, hurtful, but they want to use it, they want to have a immediate effect. So they use a very immediate action, such as substance, or even they start buying a lot, they start eating a lot. So probably we can just wonder if we are not mindful enough. So probably sometime when we are stressed, we will eat more than usual. We will start eating snack more than usual. So this is part of the way we manage our emotions. But if we excessively using it, it can be turned into addictions problem. Hiding the behavior or lying to others about the time spending on it. And when we difficulty to avoid the behavior, when we difficulty to control, and then when it comes to others symptom, when the continue doing it, and it comes to a level that we become irritable, and also restless, anxiety, when even with depressions, and some of the drugs that we use that can cause withdrawal symptoms, and when we try to quit. So when we compelled to continue, feeling compelled to continue the behavior, even though when it causes distress. So this is the consequences. So So why people get involved in addiction? They are basically, we are dividing into a biopsychosocial causes. Basically, is here I explain is more towards bio and psychological causes. Biologically, we need to understand that in our mind we have this reward pathway. When we get something, we feel happy, and it will stimulate our reward pathway. So when we get something like drugs, it will actually stimulate our reward pathway by increase the dopamine neurotransmitter to be released. This is the dopamine. In our mind, in our brain, there are a few type of chemical. One of the chemical is dopamine, and this dopamine, they function as rewards and also help us to feel happy, help us to have compulsions, and also continue to do something. So if we have stimulate the reward pathway, it will go and again, and you will feel you want it more and more again. So this is the reward pathway. So psychologically, and when in response to our pain or distress, or this pain can be referred to physical pain and also emotional pain. We generally group them into a two different type of response. So the first response is like, as Buddhists, we know that the thing that we like, we will try to catch and hold on it. The thing we don't like, we'll push away. So like when people that in response to distress, there is mainly two response. So number one is that we'll have an urge to have a different experience from the one that we're having now. So we are feeling distressed now, we are feeling painful now. We want to have using some other emotions, some other experience so that we can feel better. So the more we found that this experience is more pleasurable to us, so we'll crave on it. And then the more we hold on it, we'll become craving. And the other action is we want to push it away. We want to push away the experience. If possible, we don't want to remember it. We try to avoid it. We try to even psychologically, we try to suppress it, or even the worst is when it is so painful up to a level that subconsciously we suppress it, we call it repressions. So when something that has triggered us emotionally, either can be triggered emotionally, or even we can trigger our psychologically. So something, the trigger here have been there, so it can cause us to have a feeling of we want to use something to replace. And when we try to use something to replace, we will try to seek for it in actions. So we will try to find it out. Okay, I feel so unhappy. I want to take alcohol. I want to search for alcohol. I don't want to let my family member know about it. I want to look for it. I try to buy once and try to buy another once. And when it start to using it, and then after use it, sometimes some people can immediately feel guilt, but the guilty, and it can add on to the emotional trigger as well. So it becomes a cycle, and this cycle can be continue and continue until they start to have a lot, especially this guilt part. People can be hesitate. Since I have break once time, I have already drinks one. Why don't I drink? Try it, no difference. When I drink 1 can, why don't I drink 10 cans until I really cannot numb myself. Do forget everything. Okay, so why this is important? Because we need to understand how our emotion react, and we need to know that in response to pain, humans have different type of response. And when it come to a levels, when it become this cycle can become more and more consolidate, and people use more and more drugs, it can be overly stimulate our dopamine, and people will keep on using more drugs to maintain the level. Okay, that's why our addiction sometimes it can be very difficult to resolve it. So this is the stages of change that we need to understand about it. This is where we want to engage with somebody with having an addiction problem, or even we need to understand which are the level of our motivation for change. So this refer to motivation for change. So we name it a few stages, and this is the orange color called pre-contemplations. We at this point, this stage, we have no idea. We have don't want, if possible, alcohol, drug is not an issue for me. Continue browsing social media is not a problem for me. We can come into after a while, we come to a level that we start to aware. Oh, it possibly there is something advantageous and disadvantages. I taking alcohol. So they start to think about it. Okay, I taking alcohol too much, we like injured my causing a lot of liver injury to a liver injury, and can causing a lot of problem to my life. And then they start to thinking about um, uh, uh, thinking about whether I should change. But at this stage, anytime you can go back to the pre-contemplations and preparation. They start to prepare. They start to think, okay, I should change, and then I need to do some action. They come out some action plan and start to prepare for it. And when they go into actions, and then this is something that the action is. And after that, after they stop taking alcohol, and then they try to maintain don't not taking it. But anytime it can be have what we call it lapse. Lapse, it means that I accidentally I drinks once because of the social occasions, and then we drink once, and then subsequently I'm not drinking anymore. Okay, but sometimes some people can come into a level that relapse, meaning that not only drinks once, they, because of the negative emotions, negative restlessness. Oh, I drink one, it seems like quite okay. I don't think I will drink as previously. Then I drink 2 times, 3 times continuous drinking, and then it go into relapse, then it go again into the relapse into the addictions problem again. So here they give us some hints that if someone that in the pre-contemplation, they have no idea want to change, so it's actually we need to help them to build up the awareness. So what is the reason they need to change? So usually we tell them what is the pro and what is the cons. Okay, contemplation is we always tell them what is the benefit for them to change. So so that to reduce what is the disadvantages for them to taking alcohol, for example. So preparations that need to help them to come out some plan, and after come out some plan, need to assist them, encourage them how to commit about it. And the action is we always need to revise, because sometimes they always have a fail, and then how we continue to encourage them to commit again and again until they are up to a level they successfully stop drinking. And finally, manage to help them to maintain the sobriety, and then continue stop drinking and so on. So this is something that we need to learn when we want to help them in terms of stopping taking drugs, or even stopping addictions. So how are we going to overcome addiction problem? Here I share a few ways. A few ways. Number one is we can use biologically, psychologically, and social, and also from Buddhist way how we can help them to overcome. And also we can use this way if we ourselves have the addiction problem. We ourselves can use this method to help us to get over the addiction problem. So Number one is medications. In some case, medication can help people working through the addictions, which are great successful, especially for those chemical addictions. So if people were dealing with the chemical addictions, such as we call it substance use disorder, such as alcohol, there are medication can help them stop drinking. And there are medications that help them to reduce the withdrawal so that they can get over the withdrawal periods. Okay. And nicotine use, there's smoking. Okay. They are like nicotine patch and also gums to help them to reduce the desire, because as I said, when people come to this level, they are using drugs, they have a lot of emotional issues that their nerve have been either been overly stimulated or overly suppressed. If we want to help them, probably they still need some of the medication to at least let their nerve a bit stable so that they can go into the rehabilitation program. Okay, so it is recommended combine the medications with others approach, such as either therapy or also some rehabilitation program. We notice that some patients they have very difficult if they just continue by using medications alone, or if they continue with substance if the rehabilitation program without, for example, people with opiate, they need the methadone. If not, they have so difficult, especially for the first few months. They can be they will be stopped. They are stop the rehabilitations program so easily. So psychological interventions. Psychological intervention is try to intervene the root. So what is the problem? We say that because of the emotional trigger, because of the psychological distress that can start causing people to crave, and then subsequently they develop some ritual and continue using it. So we need to address the psychological issues that here. So we need to find out what are the issues behind the substance use of the behavioral addictions. So some people, we can see some kids that they go into this social media or computer addictions, we so-called computer addictions. Um, um, why? Because they are lacking of the connection with the family members. Okay, when they're lacking connection with the family members, and because they either they lack of skill or they have a problems, some family for some personal emotional distress. So we need to deal with it, and if we can help them to overcome the anxiety. For example, some people have social anxiety. We help them to overcome the social anxiety. They can come out from the social media addiction. They can go to connect with people. So this is something that by using psychological intervention, we can helping them. So a lot of way, I just list out a few examples like CBT and septum commitment therapy, or even any mindfulness-based interventions. We call in one is mindfulness-based relapse prevention programs, also can help in terms of addiction problem. So social interventions. Social intervention, there are a few. One is called it as residential treatments. They call it as, we put them in rehabilitation center. Then we put they got a specific rehabilitation program. They need to follow the rehabilitation program so that they can go through the difficult period, because if they are outside of these residential treatments, sometimes it's a bit difficult for them. They will go back to the old norms, and then they'll get engaged back with the old circles that with more towards the substance. And here we found that social is quite important in dealing with substance or addiction problem. The support group is quite helpful. And in Malaysia, we have this Alcohol Anonymous and Narcotic Anonymous. There is, but still not so famous in Malaysia. But overseas, there are a lot. Now they got other programs such as 12-step programs. They are having some smart recovery, a lot of different type of recovery program that's coming up. The concept basically is support group, using the clients to support the client by themselves, the peer by to support them, because they have been going through the substance, the addiction problems, and then they are the best person to lead them, to guide them. This is one of our Buddhist concept as well. We can using the Sangha concept, lead them coming out from the difficulty. So okay, now I introduce something I found it quite interesting is this is called 8 steps recovery. Just now I got mentioned about one of the support group program, name it as 12-step recovery program. That is a bit that is quite some time there. Basically, if you look at it, it's mostly is follow something Christianity, and then they have come out some program according to a 12-step. And I found this program also quite interesting, because this is using something that according to our using our Buddha's teachings, how to for this program. And so the first one is accepting that this human life will bring suffering, seeing how we create extra suffering in our life, embracing impermanence to show us our suffering can end. This three actually is the first three of our Four Noble Truths. And then subsequently, we need to be willing to step into the path of the recovery and transform our speech, action, and livelihood, and also placing a positive value at the center of our life, and making every effort to stay on the path of recovery and helping others by sharing the benefit we have gained. So if you understand Buddha's teaching, and then you will find that this is something that quite relevant to our teaching as well. So I will explain one by one, and at the same time I will incorporate what I usually I will do for my patients, and which is acceptance or commitment therapy. I will introduce one or two tools that it will be also part of, can be put under part of this program as well. So the step one, when we have experiencing addiction problem, so number one, that we need to understand that we need to, this human life will bring suffering. So basically people with addiction problem, they understand that this life is suffering, have a lot of suffering. So tell them that yeah, and when they heard about when human life will bring suffering, they actually find a relief, because they say, oh, actually not I'm the only one suffer, everyone is suffer as I am. So so then we need to teach them having a suffering is not this is tell you that the world is the end. It's tell you that yeah, everyone have the suffering, then we must learn how to live with the suffering, how to face our pain and emotions, emotional pain and physical pain. So how to practice this is a bit challenging, for especially for addiction, people with addiction. So at the beginning part, the most difficult part is when we want to tell them that look, addiction is a problem, and if you continue like this, the only way is continue suffer. So how are we going to face it now? So and the addiction, why is why people get addiction is because we have a lot, we try to either find some pressure, try to find a pressure, a different way from we want the problem that what we want to avoid, and we try to push away the problem that we have. So now the thing is, let's go back to face our life, that is we go we'll feel anyhow, we'll feel a lots of emotion, a lots of pain in our life. So we tell them and then let them to understand that this, although this is difficult, but it can be doable. So the first step we need to teach them is we need to learn how to notice our pain. Notice our pain is difficult because a lot of people will uh, focus on the pain, and they will focus on the story of the pain, the interpretation of the pain. So even when you talk about with them the pain, they will relate to you. 10 years ago, I had been abused by my father. How my father scolding, I'm a stupid. That's why I take drugs. So a lot of this problem, it can cause us to be so painful, and then you try to avoid the feeling, and we need to help teach them how to use the mindfulness to help them to notice the pain as if it is the pain only. So a few keywords is quite important, how to teach them when to stop, how to pause, and how to slow down. Okay, so be present with the suffering and how we notice with that our thoughts are feeling and situation that arise. So number one is be present. Okay, this is the triflex by acceptance commitment therapy.
Excuse me, Dr. Lim. Your mic is off.
Okay,
Yes,
okay,
thank you.
I accidentally switch off it. Okay, thanks. Okay, so this is the triflex for acceptance commitment therapy, and the first one is to be present. It is situated at the center. It actually help us to stabilize ourselves. Is the central of something that we need to pay attention first, and then how to open up ourselves. Sometimes we have emotional pain, we have difficulty. Do you willing to open up to accept the suffering, to accept the difficulty, to open up to diffuse it from you are, and then finally how to doing what's supposed to be matter from us. And actually you will realize that these asset programs are actually it also it will go according to these three elements as well. So we are talking about be present with the suffering. So how to be present with the suffering is something that is very difficult. And first of all, be present. We need to ask them to notice. Yeah, understand that. Look, now you are in this kind of situations that you have this addiction problem. You feel so painful. You feel want to push it away. You feel you don't want to feel it. Just try to be present. Okay, try to be let it understand this is the pain, the emotional pain. It can be the sadness, it can be the anger. Just aware about it. Just notice it and slow down, and also try to have a pause rather than continue and doing it until just like the rats under the wheels. So I teach you one methods that could be helpful. This is the tools under the ACT, which is called, name it as dropping ankle. It's mainly is how to help us to become be present again. So sometimes we were asking uh, when we are in the people in a life that very chaotic. So sometime every day is thunderstorm for them. So just like people sailing on the sea. So when they're approaching the harbors, uh, when you are reaching, there is a thunderstorm coming, every day have a storm. So we need to find a way to drop the anchor down, and so that we at least that our boat is a bit stable, so it will not be flipping over. Okay, so by practicing mindfulness skill or this dropping anchor skill, actually is a way for us to be stabilize ourselves. At least you can start to go, either you can open up you can open up at the left side, or you can do whatever you matter. So it's not the first skill we usually teach is be present skill, which is dropping ankle. So so I'm going to teach you how to do it, because I think it's quite important for us to practice this kind of dropping ankle skill. So I would like to invite everyone, probably just to sit in the comfortable positions. Probably I would like to invite you to bring in something that probably can make you feel a bit distressed. It can trigger your emotion a little bit. It could be happens. Don't bring in something that very big. Just bring in something that probably recently something that have triggered your feelings. Okay. I want to sit down and notice your thoughts. What are the thoughts that when you flashback, float back about this incident? So, and try to sit back and then feel what are the feeling that you can feel it. And just acknowledge that, yeah, this is something that really trigger me. Or and try to notice that what are the feeling that surface up. It could be sadness, probably the pandemics, some you losing someone, sadness have been coming up. It could be some anger for government not doing anything. So, or it could be some happy. Oh, finally this thing had passed, you feel happy. Or it could be some fear. Oh, somebody around me get COVID. So I'm worried that I might get infected. So you can notice what are the thoughts and feelings. Just acknowledge them and don't suck by them. Don't follow the thoughts and try to anchor back now and acknowledge the thoughts and emotions that understand you are difficult, and then try to connect back to ourselves. We can use our breath and also body to anchor ourselves down. Okay. First of all, probably body is our very good companion to help us to drop the ankles. Okay. If you put your foot down, you can step on the floor. Feel the sensation on the floor. Push your hand over your thigh. Have a stretch over your body. Turn around your head. And another very good companion is our breath. Take 3 deep breathing. Breathing in as deep as you can. Let it go as much as you can. Breathing in as deep as you can. Let it go fully. Breathing in. Let it go. And now bring back our attention back to ourselves, our body, and try to engage that something that you can hear at the moment here and now. At least you can try to listen something that's surrounding you. 3 to 5 different sounds that you can hear. I can hear the fan sound. I can hear my own voice. I can hear there's something outside. Try to feel the sensations, the room temperature, your body posture. Look around. Look at something that probably in green color. 3 to 5 things that in green color. My wall is in green color. My towel is in green color. The screen is there is screen sharing here is in green color. And let's shift to something that in blue color. The screen, the sea is in blue color. There is a cup here in blue color. There is a basket in blue color. And let's recycle this again. Try to acknowledge back your thoughts now. Check back. How about now? How is your thoughts now? You're still thinking as something that we are floating back? Or the thoughts have changed? How is the feeling? Is it the feeling the same or the feeling are changed? Just acknowledge them. Understand that the feeling, if okay, is same, is doesn't never mind, is never mind. If didn't change, still feel negative emotion, it doesn't really matter. It also never mind. Just allow them to be there. Try to connect back to our body. Step on the floor. Feel the sensation between your feet and your floor. Push your hand over your thigh. Feel the sensation between your hand and your thigh. Have a stretch, feeling of the sensation of the stretching. Have a big stretch. Connect back with our breath. Take 3 deep breaths. Breathing in. Breathing out. Breathing in. Let it go. Just acknowledge your thoughts could be there, your feeling could be there, your breathing is there, your body is there. And try to engage to the sounds that you can hear now. 3 to 5 different sounds that you can hear at this moment. Feel the sensations, the room temperature, your body's posture. Where do your hand place? Where do your legs place? Look around, there's something seeing in red color. Something, shift to the attention to something in yellow color. And come back to the sessions. Hope that you still connected with me, although I can't hear from you. So hopefully you are still connected with me after you drop an anchor. So I would like to discuss a little bit about why I prefer to use this method rather than other methods, especially when we first engage with someone that really have addiction problems. So if we want to introduce some skill, the skill need to be brief if possible. Because this kind of skill, they can learn it fast, and then at the same time, they can address their thoughts and feeling. Tell them that it's okay. I understand you are suffering, you are difficult, and try to anchor back with our body and our breathing. Remember that our body and our breathing is a strong anchoring and try to engage with the surrounding by noticing the sensations. So by doing this, actually they start, the more they do, you can extend it. Either you can extend at the breathing, you can extend at the at any part that you find it they are more helpful to them. Okay, some people do have some sensitive to certain things, so it's okay, we can just let it be. So with some people, when they have a addiction problem, they couldn't even do the very short moment of silent moment, even like 1 second or even one brief second. I do have patients that have this problem. I asked do breathing, they thought, doctors, I just cannot do it. Okay, I said it's okay, then you just engage back with your body. So number two, we need to understand we create extra suffering in our life. Okay, why this that it's phrased like this? So every time when we try to move away from the pain, actually we multiply the suffering in our life. So uh, when someone who have emotional pain, or if you have physical pain, they try to keep running away. At short terms, it is something that defense mechanism. It is protective mechanism, but in long run, it create more problem. So when some people initially they have feel sad, so they start drinking to try to feel make them feel a little bit happy. So when or they try to think that, okay, by drinking I can run away from this problem, but the more they think this method can help them, every time it become continuously, then it multiply the suffering, and the person ends up with other consequences. Okay, the consequences are they lose the relations, the family, they lose the time that they can putting their responsibility to contribute to the society. They lose their health, they lose so many things. So we need to understand we need time, and we need to sit with the pain. So and sometimes that we need to let them know that our thoughts, sometimes what our thoughts telling us, it's just like a radio. It keeps telling you a lot of information, but not all informations are actually related to you or is a fact. So we now we watch so TV, so many social media, we got so many news, what, and so many news about COVID. Some of the news, then after 3 days later, you find out it's a fake news. So it sometimes our thoughts can be like that. We share so many informations. So do not always believe our thoughts. Sometimes is we need to come back. So still remind them, you need to come back to the present moment. You need to come back to the feeling, to the sensations. So here we need to help them to identify the things that can trigger them. So a lot of time when they have this, the starting point is something that can trigger the emotions. So it can be something that situational, some situations that happens, it can trigger the emotions. He saw someone that he don't like, so he feel angry, so emotions surface up. Or it can be the thoughts. You think that what happened to me, I'm so useless, I cannot contribute in my society, I'm talking nonsense, I feel so shameful, I feel so guilty, so the emotions start surface up. So this is the thoughts. And the emotion part, the guilt, the shame feelings that can be coming up. It could be because 10 years ago I'm being abused by the friends. So I'm so angry, the anger having surfaced up. So there are so many things when we look at it, the emotional trigger, it can be the thoughts, it can be the situations, it can be um, the feeling, and sometimes it can be the urge, what we call urge. So when somebody crave for crave for social media, for example, when you take your phone out, then every you take your phone out, it automatically turns to Facebook. So the urge is there. So when the urge, if you didn't pay attention enough, then you automatically will go and tekan Facebook. So this is something that we need to identify what are the triggering factor. It could be the thoughts, it could be the situation, it could be the urge, it could be the emotion. So especially those high-risk situations that it can be bring about a relapse. For example, some people, when they go to mingle around with those drug addicts or mingle around with those friends that are always drinking, okay, or when they saw the bottle, when they saw the drink, the alcohol bottle, or when they uh, uh, so they need to identify, each people have their own high-risk situation. When you identify it, aware about it, acknowledge it, and acknowledge that this is going to bring me go through the cycle again. I'm going to go to this cycle again and again. Then this is second step. Okay. The third step is embracing impermanence to show us that our suffering can be end. So we understand in Buddha's teachings teach us that impermanence, that everything's in our life is impermanence, and including that something in back, the good thing is impermanence. We are going to lose the good thing. At the same time, we are going to the bad thing always one day will be ends as well. So the addiction, compulsions, obsessive behavior, or even the emotional pain one day will go off. So the pain can be come out, and eventually it will go down and even go off. So we know that the pandemic will come out, eventually it will go down. Okay, so the thing is, here it creates some hopes, and it tells us that change is possible. It's possible that so all this will go one day. So a lot of people will fix at the moment that yeah, I will never change anymore. Like I'm drinking so much and I'm a drunk kaki bottle. So I will continue to drink. I'm no point for me to change. So want to have a fixed mind, and it cannot be changed. So once they understand that everything is impermanent, including the facts that taking alcohol or taking addictions can be changed. We understand that one day we can leave our phone. We can just focus on our teaching, just like you pay attention to me now. Okay, so things can be changed. So, and we understand that the change is important, then we have to begin in pay attention on any small change. So sometimes our mind can be very restless, or we can be want to have a big change, but we tell them that sometimes a small change is good enough. So we need to pay attention some small change, even our mind. We realize that we want to our feeling, something good feeling surface up, or something positive thoughts have been surfaced up. That is a good change. Sometimes people with depressions, sometimes even though you didn't see a big change in their life yet, but you see they are more talking something, to have moving towards positive change. That is a small change, and we acknowledge that, and we encourage them to go for it. Step 4, be willing. The words here is willing, willingness to step onto the path of recovery and discover the freedom. A lot of time people with in the addictions, they will think that they are in addiction world. Okay, I'm buying a lot of things. No way, no way I am stop buying. Sunday I must go and shopping. Now cannot go shopping. I go Shopee. So I want to buy. So no way I can change. So you either you want to have a fixed thoughts in the old method, old pathway, which is addictions pathway, continue the addiction cycle, or you have a chance to understand that I want to have something different. I want to something that different from my life now. So I have another way. So change to this, call it as recovery. So, and we identify with something that we want more on recovery. how to do it, how to cultivate the willingness, and we need a lot of loving kindness in our life. So here we need to cultivate the loving kindness and tell us ourselves, we need to keep reminding ourselves, may I be well, may I be healthy, may I be safe. I understand that I'm currently situation is not okay, so I hope that one day I can be okay. So need to put a lot of self-compassion to relieve ourselves from the suffering, rather than we keep continue ourselves in the suffering. Okay, to indulge in the suffering. So how to do the loving kindness in practice? Either we can do the traditional way of loving kindness meditations. Okay, we can chant metta, or you can do something very kind talk to ourselves. Sometimes that just put ourselves sometime. Okay, I understand that. Yeah, I need some time to myself. I understand that today I'm a bit difficult. Today is my difficult day. For example, now we understand pandemic is quite uh, make people we cannot go out. We cannot meet a lot of people. We can have a lot of losses. People, probably our friends have lose their life, or it could be very sad that in surface out. We need some time to talk to ourselves. It must be very difficult for me myself. So I will do whatever. It must be very difficult. Allow yourself some time, and then probably can some more wishes ourselves something that metta, okay, loving kindness, and do something kind to ourselves, something that kind to ourselves, like we are very stressed, do some kind deed, for example, have a warm water shower, okay, have a walk, allow yourself to be have something. And remember, some people for example, some people say taking ice cream for myself is kindness. Yeah, you just take one is okay. Then you take 10, it become addictions. So that is something that we need to aware about that. It's kind but not indulge over. So when we come over to Buddhist teaching, it still come back to moderations. It's not something that over, and we need to understand it is not something that even self-compassion or loving kindness is not something that uh, overly uh, allow yourself uh, to have the leisure or anything, uh, or to suppress yourself. So when we aware, we have a willingness want to be go into a recovery path. So we need to start to do some change in terms of our speech, actions, and also livelihood. We have to start to change, and then we have to start to transform. And especially we need to handle our unhelpful action. For example, we need to start to acknowledge that some of the previous actions are probably previous speech, previous actions or even previous livelihood previously have worked in some place that easily engage with addictions. So we need to transform it. We need to acknowledge that all these actions, speech, and also livelihood do have some impact on me, and this impact it make me go into this addiction cycle. Okay, and I want to make an amend and plan to do something differently, must do something differently. Okay, so that I'm not going back to this addiction cycle again. I will go into this recovery cycle, and need to make a promise, not an empty promise. Need some plan of actions, and you need to know what shall I do so that I can go into this recovering cycle. The words forgive ourselves is important. a lot of time they are not actually forgiving themselves. So that's why they will continue and continue going back to the addiction cycle. So forgiving yourself and commit to the life that more in line to the training principle. The here is training principle. You can determine whether it is like us Buddhists, we can use 5 precepts as our training principle. Or you can okay, I'm not going to go into drinking alcohol anymore, or I will stop. I will only allow myself for serving Facebook for 1 hours per day, something like this. So you have something that you have commit into it. So here, remember, the first one is we say is be present with our emotion, be present with our thoughts, be present with our situations, and we notice it, and also we have a decisions, and we open up our difficult emotions, okay, by loving kindness, and decide we want to change, we want to go into recovery life. And finally, we need to have move into the doing something that we matter, which is how to doing something that matter. The first thing is we need to have a positive value uh, that will support in the recovery. Okay, what is value? Value is something that can provide us a directions. It doesn't give you value and goal. So with value, then we can come out some goal. So value is something usually it is a directions. It give us some direction. For example, honesty, truthfulness, loving, being compassionate, being helpful. This is something that positive value. Okay, and like for us, we can use our Buddhist value is we get enlightenment and help all beings lah. This is our final value that we try to move towards, and they provide us some direction, and we can start from with the direction. We can start to have some goal. We call it value congruent goal. We start to set some goals that how to move towards it. So you can move towards it by saying, for example, if your value is something honesty, I will when we meet someone, I will be honest to other people. I will be truthful to others, and I will always be helpful to others, even a small things. So this is value congruent goal. When you set goal, it need to be realistic, and remember realistic if it is need to according to a level, step by step moving forward. So finally, the seventh step is making every effort to stay on the path of recovery. This is something that how we make the goal. After you set the goal is something that, for example, I want to be being helpful. So I will meet myself. At least I help my family member. I can't help all beings. At least I help my family member to do some household chore every day. At least one. Okay, that is number one, your effort. And you need to remember to commit it, and also making all effort to continue it. And so in this process is also not an easy process. How to commit it? A lot of people will, when it come to this stage, a lot of things will coming up, and lapse and relapse will always coming in. So they will start always have this unhelpful state of mind can be raised up, such as the desire. I'm so I abstinent for so long. It's okay lah. I just drink one time lah. One time I drink and then always drinking. So the desire this desires is inside is coming out before you drink. Or some people will start doubt. Yeah, what I'm doing now is basically a bullshit lah. So I have basically I don't know what I'm doing. I'm nonsense here. Okay, all these doubts start to come surface out. Feel boring. every day doing the same thing, I feel so bored. I need to something make me excited. I feel shameful. I'm seems like not working, still unemployed now. I'm still feel useless or hopeless. So a lot of negative emotion it can be up. That's all this unhelpful mind. We need to aware it, acknowledge it. If we need to do something on it, need to do some work on it. If it is so bad up to a level, really needs to seek some professional help to address all these things. So prevent the unhelpful state of mind, and if possible, try to eradicate it. And remember, relapse is something like this: is go down just for a short while, and relapse it go down. You need a more effort to coming back to the old one. So anyhow, remember that all the effort that actually you made, actually it be goes up the recovery. So although you have a lot of lapse like this, although it's go down a bit, but it in total it will goes up. So I always encourage them, yeah, you seems like have a drop now, but every drop, if possible, we can do something on it, and you continue to commit about it, and finally you will still achieve the recovery. And they need a lot of support in terms of when making this effort. So cultivating the helpful mind, all this generosity, kindness, gratitude, they always need to cultivate all this helpful mind and try to prevent and eradicate the unhelpful mind. And finally, if we have more helpful minds, and then we need to maintain it. And we also need to know that what are the hindrances, being bored, being lazy, try to be, it can be a deter our efforts to go on. And finally, helping others by sharing the benefit that we gain. So helping others and share our recovery experience is important, because in helping others, we also help ourselves by consolidating the recovery. Tell us, yeah, look, you have done this is important. You have done a good job, and then you need to continue because you're able to help others. So it also makes us have a sense of purpose to carry on. And another thing is like all this support group and also 12 steps. What is so important is the support is important. So 7 and 8 step, especially I think from the first step until the last step, it need a lot of support from others. So be the support of others, and you also at the same time will gain a lot of support. So aware about expectations. Some people will expect others to, if possible, return the help to them. So this is something that we can teach them. Sometimes if you expect something like that, it might not be turned out, then you will go into the suffering again. So finally, so when we talk about this triflex, so we remember to be present. At the same time, we try to open up our heart to be present with the suffering, be present with our the addictions, thoughts, emotion, and feeling, and open it up and try to accommodate it, allow them to be there. And if possible, we're able to commit and do something different than our life. Okay, with that, thank you so much.